Okay, so now I would excited to introduce our keynote speaker for the evening, Jim Collins. Jim received a master's degree in chemistry from the University of Arizona and a Juris Doctorate from the University of the Pacific. He practiced environmental law for 20 years and joined the chemistry faculty at Sacramento City College in 2002. He was appointed Dean of Science and Allied Health at Sacramento City College in 2010. As Dean, Jim works with the faculty and student services to support innovative approaches to support student learning, and his strategies focus is on increasing diversity in health occupations, improving access and success in STEM courses, and supporting science literacy within our communities. I'd like to welcome Jim Collins to the stage.
Wow, this is a tough act to follow. And I do want to change what I intended to talk about a little bit in response to what I've heard tonight, and to share with you what I call news from the front. I feel that one of the unique things about community colleges, and by the way, I love working for community colleges. You are, especially as a dean, because you are both in the trenches and then you're at policy, and you go back and forth and back and forth. So you see how individual student experiences are impacted by policy, and you get mad at policy, and then you realize that the policies are about 3 years behind the time. So it's a wonderful position to be in. So I'm passionate about the work that we do in my division to improve equity for our students. And so I wanted to share with you sort of my perspective about the work that I try to do, kind of a personal statement. First, I think in adages. I like to make up mottos for my students when I was teaching chemistry. And the one motto I have, I keep in mind of is, they are all of our students all of the time. They are all of our students all of the time. And what I mean by that, whether you're in K-12 or community colleges or four-year transfers, we have an interest in each other's business. And we need to be in each other's business. And that's what I like about community practice. It got into our business, and I, tonight, got into your business a little bit. And I really appreciated that. And it's a great business to be in, isn't it? So it's important we keep that in mind. The second one is that the challenge we face is not that our students are unprepared for college, are not prepared for college. Our challenge is that the colleges are not prepared for our students. And I think it's very important to keep that in mind as well. So often, we wish the world was different. I wish we had different students. I wish we had this. I wish we had that. But the truth is that we are where we are, they are who they are, and we need to deal with it. We need to deal with it. They're looking to us for ideas. They're looking for us for commitment. Many of our students come to us wounded by the experience of school, wounded by their life experience. And I could tell you dozens and dozens of stories that I hear every year around this. So we need to do the work. I also want to share with you that I have extreme optimism tonight, extreme optimism about the potential we have collectively to address the problem or the challenge of diversifying the healthcare workforce. This is a basic social justice question, and I believe we're up to it. I believe we need to be up to it. And I want to share with you why I'm optimistic as a community college person, practitioner. First, in particular for Sacramento City College, there are so many connections that we already have with this fine university. We have a campus, an instructional center right on this campus. We just added a new building that's going to be providing science education, lab classes to students from the area. What a fantastic opportunity to do joint research on interventions. And there's numerous personal connections to the campus. Dr. Miller from our chemistry department has been working for years bringing students onto your campus to work on electron microscopy, for example. Many of our faculty are working with Dr. Lamar Larson in his open source initiative, open instructional resource initiative. Again, these are seeds that we can build on, we can grow. Second, the truth is community colleges are where the students we need to engage in order to move the needle. Let me just give you some basic facts about that. Each year, 3,200 students are graduated from high school in the Sacramento City Unified School District, 3,200. Of those, 2,400 do not go to a four-year institution. 2,400, 75% do not go to any four-year institution. Of that 2,400, 1,920 don't go or can't go because they don't qualify for admissions. 2,400. 1,920. And many of those students are students of color, poor, and so that we are an essential ingredient to moving the needle. And I think that we need to own that as a community college. The community colleges need to own that responsibility. The third thing is that I'm really proud of the work that we have done in my division over the last 8 years, and actually for the last 12 years, addressing diversity in healthcare. Sue Hussey has been a leader in our campus on that. I'd like to just mention two things. We formed the Allied Health Learning Community, which is about 8 years ago, that has shown that integrated student services and academic services works. And a cohort model works, especially for underrepresented students. We just initiated a new program that looks at STEM more broadly, the STEM Equity and Success Initiative. This is a 5-year program funded by DOE, and we are looking at who isn't in STEM. That's who is not there, and we go after them. So, for example, this grant supports increasing Hispanic students' participation in STEM and transfers to 4-year. But there's a lot of Hispanics out there who are quite qualified and quite capable of doing just fine themselves, thank you. We're after the students who don't see themselves as that their experience says, no, I can't go there. That's who we want. We want the students who have problems with cognitive processing. We want to work with students that have for example, we have students in our program that can't hear properly, that can't see, undiagnosed depression. These are the students that we attracted in our first cohort with SESI. And I'm proud of that. I think that's the students we need to reach too. And last, I would like to say that this is a fantastic time to be in community college because of so much of the transformative work that's taking place right now. I don't really want to go into, I really can't go into all of those, but I would like to point out that we are, the system-wide, the community colleges system-wide is undergoing transformative change. And we are ready to listen, and we are ready to collaborate, and we are ready to work with all of you, K-12 and 4-year transfer. We need to work with you. And so I was thinking, well, what else would I need from you all? Because I'm always looking for something from me, right? And my kids. The next deal, as Sue and I talk about sometimes. I would like to know what the experience our students have in your institution. Seems like a simple thing. It's hard to find out. How can we track students into your institutions and understand that experience and see where we're deficient and see where we can improve? And I'd like the K-12 faculty, the folks who teach in K-12, to know how their students do in our institution, so that we can say, where are we falling down? Where can we do more? Where can we be better? And in fact, we did that work. And what we learned wasn't that it wasn't rigor. It was really the psychosocial issues that students had. That was the issue. So while I'm all for rigor, I am convinced that that is not the core of the problem. The core of the problem is that we don't understand and we don't address these psychosocial issues that our students come with us from. And some of that is the culture and the practices of K-12. Giving 6 or 7 opportunities to do the same assignment over and over again, right? And they come to community college and wham, they hit a wall. And we lose a lot of students in that first semester. For example, what's interesting about African Americans in our community, our college, is that they are about 50% underrepresented in STEM, and they're 50% as successful as the average student. Okay, but when you really dig into that number, most of that's coming from the fact that African Americans take a W. They withdraw from our classes. They don't stick around. So what is that? Are we not inviting enough? What are we not doing for them that they need to have done? So those are the kind of questions that I ask myself regularly. And I think that we have an opportunity here to extend the work, the great work that's been done here. I'm amazed by it. And I have so much to learn from you, believe me. But just sharing data, let's start with that. Because what I have found that when you put professional educators in the same room and they look at data, good things start happening. They can't help themselves. And so my experiences working with K-12 have been fantastic, and I would like to share that experience with you as well. So thank you very much.